Polynucleotides are a relatively new treatment to the aesthetics industry, but they have been around in medicine for a long time, used for their wound healing properties. So although they're new to aesthetics, we have been using them in medicine for a long time for other reasons. Where do I start with polynucleotides? Quite honestly, they're a very exciting treatment to use because they are so versatile. So how they work is they're injected directly into the dermis of the skin. They act to increase the action of a cell within the skin known as the fibroblast. The fibroblast produces collagen, amongst other things. And because the fibroblast action is increased, the collagen in the skin is increased. Polynucleotides also have other effects. So they are what we call biostimulators to stimulate collagen and elastin production, but they also act to reduce the leakiness that we see as patients get older from tiny little blood vessels, for example, around the eye. And by reducing that leaky blood vessel, then they can act to help reduce the deposition of pigment into the skin around the eye. That's called a hemosiderin pigment. So what can they help with? They started off really being used mainly, and in my clinic I still do this, I do this a lot. This is a really popular treatment for reducing the tired appearance around the eyes. So reducing the appearance of the dark circles, reducing that slight dip that we all get. I have it here and here. Polynucleotides help to improve the collagen levels in the skin, and they reduce that dark appearance. And in doing so, they give a lovely brightening effect to the skin around the eye. In addition to that, they give a brightening effect to any of the skin. Particularly people love, I find when I do the treatment around the eye, I have a little bit of product left over, and I tend to spread it around the crow's feet area and across the tops of the cheeks. And that gives your skin a lovely, fresh glow. Now, polynucleotides are a bit different to other treatments we do in clinic where you may see the results very quickly. There is a little wait for the polynucleotide to work. And that's because we have to think of the polynucleotides as like a gym workout for the skin that we've injected it into. So it takes a little bit of time to get those results, and they gradually improve over a period of around 8 weeks following the injection. You usually need 2 treatments spaced around 3 weeks apart for most things, but we vary that depending on what we're treating. Polynucleotides can also be used to treat acne scarring alongside other treatments, so they complement treatments like skin pen microneedling. So we may get you in for a skin pen microneedling, 2 weeks later polynucleotides, 2 weeks later skin pen, and we use it alongside other treatments, and it complements them really well and enhances the effect significantly. The other thing that polynucleotides do is that they're now complementing filler use in patients who have deeper lines and wrinkles. So we're using polynucleotides either combined with a hyaluronic acid filler actually within the product, or separately to complement those results. Polynucleotides are now being used by surgeons post-surgery for encouraging wound healing and reducing the formation of more significant scars. So they're being used in medicine, they're being used in aesthetics. They're a really fantastic treatment. I'm so glad to be able to offer them in my clinic. They have lower risk than a lot of the other treatments that are offered here, although everything is relatively low risk. but their risk profile with regards to things like vascular occlusion is low. So we love using them because they get results. It may take a bit of time, but the risk of using them is very, very low. So if you're interested in polynucleotides, please book a consultation on the book a consultation page of the website.